Hi everyone, it's Derek here from ADUMED. You find that medications, their indications, side effects, and also their interactions are really commonly encountered in exam scenarios. So I thought I'll explore this topic by looking specifically at depression and looking at antidepressants. So we'll cover all of this and more in today's video. With that said, let's dive straight in. Patients who are depressed will have the core symptoms of a low mood, in addition to the lack of pleasure in doing things. Now, these symptoms will need to be present on most days for most of the time for at least 2 weeks before we can diagnose depression. When we commence a patient on an antidepressant, current guidance states that we should review them within a week if they're between the ages of 18 and 25 or if they're at an increased risk of suicide. For all of our other patients, we can review them within 2 weeks. Within the first 2 weeks of starting medication, patients may experience increased anxiety, agitation, hopelessness and suicidal ideation. Therefore, strong safety net advice should be given. Antidepressants take about 4 to 6 weeks to take maximal effect. They should be continued for at least 6 months after symptoms improve. This is to reduce the chances of patients relapsing. Patients often worry that they will become addicted to antidepressants, but we can reassure them that they are not addictive. However, they may experience withdrawal symptoms if they stop taking them suddenly or if they miss doses. NICE guidance suggests using the PHQ-9 to monitor the response to treatment. So let's move on to our selective serotonin reuptake inhibitors, or SSRIs. Sertraline is particularly useful if the patient has comorbidities, as it is less likely to interact with other medications when compared to other antidepressants. Citalopram and escitalopram risk prolonging the QT interval. They can also cause hyponatremia. Now, a common adverse effect is that of gastrointestinal upset. Particularly, there's an increased risk of GI bleeding. So if a patient is also taking an NSAID, a PPI should be co-prescribed. Serotonin syndrome is an important but rare adverse effect. Symptoms include confusion, sweating, shivering, changes in blood pressure, and myoclonus. This can occur when the patient is co-prescribed more than one serotonergic antidepressant. Now, our SSRIs should be used with caution in children and adolescents and usually require specialist initiation. In these subset of patients, fluoxetine is the preferred drug. Moving on to SSRIs and pregnancy, the risk and benefits need to be discussed and assessed with each patient. If SSRIs are used during the first trimester, there's an increased risk of congenital heart defects. If used in the third trimester, there's an increased risk of persistent pulmonary hypertension of the newborn. Paroxetine particularly has an increased risk of congenital malformations if used, especially in the first trimester. Now moving on to our serotonin and norepinephrine reuptake inhibitors, our SNRIs. This is the newer class of antidepressants and is contraindicated particularly in patients with uncontrolled hypertension, with impaired liver function, seen especially with duloxetine, and also in patients with severe renal impairment. Our tricyclic antidepressants are less commonly used in depression due to the side effects and also due to the toxicity in overdose. These class of medications are contraindicated in patients with heart block, patients who have arrhythmias, and also in that recovery period following a myocardial infarction. Common side effects of our tricyclic antidepressants include the typical ones we tend to see with anticholinergic medications. So you think about stuff like palpitations, drowsiness, constipation, urinary retention, blurred vision, and then dry mouth. Let's look at mirtazapine because this works by blocking the alpha-2 adrenergic receptors. This medication has less side effects and interactions than lots of the other antidepressants, and because of this it's really useful in the elderly or in our patients with many other medications. Common side effects include sedation and also an increased appetite. Thanks for watching today's video. As always, if you found it helpful, don't forget to leave a like and subscribe to this channel. I always say this, but I always like you to apply all your knowledge in a practical way, as this will help to get through your exam. So I've attached a link to our case study playlist, which will allow you to build on the skill. Till next time, see you soon.